Hello, APRNs. This is Jennifer. Tonight we're going to spend a couple minutes talking about test taking strategies. I think that the thing I want to say to most of you is calm down. Uh, I think that a lot of you are forgetting how much preparation is going into this exam, how much you've already done. You need to remember that you've been in graduate school and been working with this content for at least 4 semesters. And there's really no easy way. There's no way to beat the exam. I know there's a lot of gimmicks out there, a lot of products out there. But tonight I just want to talk about some basic things that will help you pass this exam. You know, this exam is, it doesn't matter if you're taking the ENP, the FNP, the, the adult gero, acute care. There's no trick. Um, to pass it. If the preparation is really important, and we're going to talk about that. And I'm hopefully going to be able to give you some strategies so when you're taking your exam questions, you will be able to maneuver through there with the least amount of stress and the best success. So let's talk a little bit about the exams. And it doesn't matter which one you're taking, they are all entry level. Okay, there's no trick questions. Right now for the FNP and the adult gero, there are two national certifications. There's the ANCC and the AANP. The ANCC just was revamped, I think last week, 22nd, um, and they have changed the blueprint a little bit. And we'll talk about that as well as we move through the presentation. Like I said before, there's no way to get around it. You need to prep. When you look at the statistics, you need 2/3 of the questions to pass, and that's a 67. Now, I want to remind most of you, your classes for your advanced practice studies required you to have greater than a B, some almost a B plus, so 80 to 84. So you've already been working well above what you need to pass this exam. I want to remind you, every single one of you has already passed the standardized exam, your NCLEX, okay? And you've already spent a ton of time with this content. So you really just need to focus on your preparation and how you answer the exams. And if you have test anxiety, kind of address that as well. So let's talk about the type of questions you're going to see. You're going to have questions that are going to ask you to identify a condition or a disorder, a disease. They're going to ask you point blank, what is X, Y, and Z? They may give you a picture and describe it. You may have a scenario that tells you a little bit more about the patient. They may talk about the history of present illness or your physical findings. So it's important as you are preparing your study materials that you kind of break down and ask some of these questions. What is it with the disorder, the condition? What is a scenario that I most likely see this in? And then the last thing they're going to ask you about are interventions, because that's what makes us different than registered nurses, is that prescriptive privilege. And when they talk about prescriptive, it's not just your ability to write prescriptions for drugs. It's writing your orders, which is prescribing, for your labs, for your um, diagnostics. Okay. So when I talk about interventions, what are the order of the interventions? The sequencing is important to pay attention to. How do you treat or correct whatever's going on with the scenario they give you? They may ask you, again, with the sequencing, what do you do next? What would you prescribe? Your meds, your labs, your diagnosis, or diagnostics. And then the other thing that's big on the exam is they may ask you about anticipatory guidance. And you guys are doing this all the time, even if you're not working currently as an advanced practice nurse. I want you to think about your patients. And it doesn't matter if you're inpatient, outpatient, wherever you're working, you are giving your patients all the time anticipatory guidance. And basically what that is all that teaching you're talking about, your discharge instructions, your instructions before a procedure. So you're doing a lot of these things already. So really don't discount what you're bringing to the table when you come to take the national boards. Right? What are you not going to see? You're not going to see any true or false questions. And hopefully you haven't been seeing that in your graduate studies. You are not going to see fill in the blank questions. So you can take a big breath. You're not going to see either of these uh, formats on the national boards. What formats are you going to see on both exams? Multiple choice, where you have a question, STEM, and then 4 choices, A, B, C, or D, 1, 2, 3, or 4, this type of thing. Multiple response, a common one that you'll see is that they'll provide you a scenario and pick the 3 interventions that you do for this patient. Now, in those questions, they usually have 5 or 6 choices. In both the exams, they'll have an EKG strip or describe and a chest x-ray. The chest x-rays have been popping up a little bit on the AANP, and I think as our technology is getting better, because many of you are already having questions on your test during your grad program, the chest x-rays and the pictures of different disorders are something that you're going to see. And even if there isn't a picture, you should be able to close your eyes and see what is going on with the disorder. When you think about Lyme disease, the targetory, your chest x-rays, this type of thing. So your different eye findings with your fundoscopic exam, you may have them described for you in both of them, or a picture. All right. ANCC only. You're going to have color pictures. Okay. They may ask you to diagnose, treat, or to identify an emergent condition. The AANP, no pictures, but like I said, I wouldn't be surprised in the next reiterations of these exams that you're going to see that. Drag and drop is on ANCC too, and a lot of times they use this to prioritize strongest to weakest. And when you think about things that would be strongest to weakest, you think about your levels of research. They may give you, for example, different topical preparations. What is the strongest versus the weakest? They're asking you to do some kind of sequential order with the drag and drop. Hotspot. This is a picture, and the question will ask you to click on a particular feature or within a particular area on the image. So, think about what they might ask you. It doesn't take rocket science. Your chest x-rays, eye, and the skin. These are common things that you may see, and this is stuff you've been doing in your clinical and your practicums out there already. All right. Tools to use to prep. Okay, the biggest thing, it can be really super confusing when you look out there and see what's available for your prep. And one of the things I like to tell students is to get a lot of different perspectives, not too many. Okay, you want to think about your review books. You've already had your content at school. You've got your perspective of whatever university you went to. You're going to pick your review books. You want to do a lot of different multiple choice questions. You need to master that. You may want to make this, OG, old school flashcards that you're using. In this day and age, there's actually a program called Quizlet where you can make your own flashcards that are tailored to exactly what you want to study. I do recommend a formal review class, and depending on how you learn, you may be able to have enough, not dedication, I don't know what the word is, the control, organization, to be able to do an online program that may be easier for you. Or I know with myself, I, know that I like to procrastinate. Totally like to procrastinate, go to the last minute. So for me, a live review course was much easier. And I know years ago when I'd taken the adult ANCC a long time ago, and then I wanted to take the family. I had the CDs to listen to, and I procrastinated, and I got through them, but it was like walking through cement. So what I did right before I took the exam was I took a live review, and I really enjoyed that. I think there's something, I know people complain about the prices, but what's nice about the live exam is that you make that commitment, you get paid for it, um, and you make every effort to be there, and you're there. Um, so that is really helpful. The last thing, and I think that's why some of these videos are so popular, is that you now want some peace of mind. So these cram sessions, just one more little thing, little icing on the cake to kind of put it all together once you've gotten through all the big content. So the cram sessions are really great too. One of the things that I would like to just caution you is, I know that I've seen a lot of videos out. Um, I see a lot of test questions, they discussion. Just make sure things are evidence-based, and that you're not getting misinformation. So lots of different perspectives. It's really important. You think about your classes. You may have had one class, maybe your first primary care class, and the professor was super dry, not really dynamic, and it was hard for you to get through the content. And then you took your second primary care class, and it was somebody who was really interesting to listen to, more animated, and you really enjoyed it. Same thing with your reviews. You just got to find what works for you. All right. So if you're taking ANCC, I couldn't believe how many students that I have come into contact with. So if you know you're going to take the ANCC exam, well, the ANCC has this really cute 2-book series, and I don't work for ANCC. I'm just going to put that disclaimer out there. I just find that if you're going to take the exam, the one way that you can beat the exam is to make sure that you prep appropriately. So if the ANCC themselves are putting out a 2-book manual that says Family Nurse Practitioner Review Manual for their exam, doesn't it make sense that you might want to purchase this? I found it, I like it. It's 2 books though, and that's one thing the one thing I've noticed, they haven't put it online yet, but I'm hoping that perhaps they will in the future. But this I find is really helpful. It's longer, it's not as brief as some of the review books, so it's kind of a nice book to use to review. Okay, another one, the Bible. Leik. Okay. One thing that's great about the Leik book, the feedback that people have talked about is that what's really nice is that you get the app that goes along with it. And what's nice is, I know when I was in graduate school, both times, I always had, we didn't have as much digital stuff the first time around, but the second time around, I always had like that review book with me or whatever. Well, now you guys have the smartphones. So, if you're sitting and you're waiting for to go into an appointment. You've got a couple minutes in the morning. You think about how much we go on to Facebook or whatnot. You can be doing some of these exam questions right along. So, and a lot of really good feedback about the questions that they're very similar to the boards. So, but I want to remind you, the boards, there's only so many ways you can skin a cat. So the more questions and the more you familiarize yourself with these questions, the better you're going to do. It's really like doing Couch to 5K, that program where people who have never ran before, by the time they're done, they're doing a 5K. Same idea. You need to have that type of mindset that you're like training for this exam. So one of the things I like to remind students too is that, you need to, kind of reflect a little bit and see, how do you learn the best? Are you a visual learner? So even if you're taking the AANP, which there aren't a lot of pictures on, if any, still, if you're a visual learner, looking at some pictures sometimes is the way that you're going to learn. And it's okay to be looking at different um, visual type of things, diagrams. I personally love algorithms, and I like to see them pulled right out, and to kind of like follow the pathway and the processes down. Some people learn best from auditory, so it may be best for you to listen to podcasts, listen to recordings, this type of thing. To put the video on, that's a little tip too. Any of these videos, you could be driving in the car and you can stream it right through your audio system or not watch the video. Mnemonics are something I love too, and it may be one that is well known, an oldie but goodie, but it may be something that you make up yourself, for you to remember. So just, think about that when you're putting together your study plan. How do you study the best? Okay. We talked about prep. It's the most important factor to pass these exams. You need time to prepare. Okay. If you know that, because this is a famous thing students always talk about. Yep, I'm graduating May the 8th, and on the 15th I'm getting married, and we're going on a 4-week vacation to Europe, or I am graduating on the 8th, and I'm going to have my babies due on the 23rd. So kind of think where you are in your life, and you really need to commit to a study plan. I would, my recommendation is to have dedicated time for those of you that have families like I did. Sometimes you have to be creative with your time. Myself, I used to work after the kids went to sleep. You may need to have to get out of your house because you don't have a dedicated study area that you aren't interrupted. Some people listen to the MP3s as they're walking for a half hour each day. So just find uh, how you can study the best, and figure out and plan a study plan. Go on your Google Calendar and block it out. Every day between 5 and 7, I'm going to study, or, I'm going to get up early between 6 and 8. And it doesn't mean you're going to go through every single system. You need to think about like kind of chunking things so you have a plan. Um, I really encourage you to familiarize yourselves with the test content and the structure. Okay. And when I say that, you can go to the AANP website, the AANCC website, and both of them have the test blueprint. Because doesn't it make sense that you would look at this before you really do your intensive training? Now, the one thing I do want you to pay attention to it with both of these, and this isn't a secret, it's online. It's right there for you. They both have a reference list. And I know you all have become familiar with reference lists in your graduate studies, if you liked it or not, those awful APA references, okay? Well, each one of them, it does talk about a reference list. And one of the things that I think that you're going to find interesting is you're going to go on there, and I want you to look and see what books you've already become familiar with. You'll see the Butaro book, you'll see the Dunphy book, books, the 5-minute consults on there. Okay, stuff that you're already looking at. And then the other thing that you'll see is that they will reference guidelines. Okay, and this is one thing that came up with the ANCC change. On the previous exam, they had JNC8. On the current blueprint that's posted now, they don't. They had the ACA. So that's why it's important for you to take a look at that, so you can really streamline your studying, and look at the stuff that you need to look at, and not get really caught up in the weeds or with, trivia per se. Practice questions. You just got to do them. Okay. I think one of the best ways to do the practice questions is to actually start while you're in school and do the practice questions depending on what system you are studying right along with. So some of you are listening that haven't um, completed school. I really encourage you to do that because, like I said, there's really not rocket science to this, and there's only so many ways you can skin a cat, so many ways you can ask these questions. So the more questions you do, the better. Um, it's important that you develop some test taking strategies, and we're going to talk about that in this presentation as well as stress management. If you have test anxiety, okay, or anxiety as a whole, I do encourage you to figure this out. It may be that you need to incorporate more exercise. You may have to see a healthcare provider. You may need a beta blocker when you take one of these exams. But I don't want you to do that experiment the day that you're taking your boards for the first time. You need to figure this out before. If you've had some trouble in school, had trouble in the exam prior, what I would do is talk to your healthcare provider, take the med, and then take one of these practice exams that's out there, just like you were taking the exam. Psych yourself right up like you're taking the exam. But like I said, you don't want to take a beta blocker or any type of Xanax right before you take the exam for the first time, because it probably won't end well. All right. Time to prepare. That's a big question everybody has. When should I start studying? How should I start studying? You want to try to take this exam within 3 months of graduation, because I want you to think about it. You've spent all this time, once a week, twice a week, actually, maybe in a live class, maybe a synchronous session, whatever. But you have been really preparing. Don't discount what you've already done, and don't wait for 3 years to take it. I mean, it does happen. It used to, like, I was really surprised, I got to tell you. But the reality of it is that there are some positions that you don't need to have national certification. It's becoming fewer and fewer, but you may, I've had students come, and it's been almost 20 years, and they're asking for the education, um, like the paper from ANCC or AANP that they've completed a graduate program. And it's been, 7 years, 10 years, 12 years. And I really feel sorry for these individuals, because this exam is geared for entry level, the person who has just come out of school, who hasn't gotten tainted and doesn't have bad habits that sometimes come once you are out in the real world. So don't put it off. You know, the worst case scenario would be that you don't pass it, but my God, you've had a phenomenal run through, and you're going to really know what they're asking the second time around. Delayed, not denied. So don't be afraid. I think that's the biggest thing. Students get really afraid, and they decide and put it off and put it off and procrastinate. And that really is a mistake. So you want to take this as soon as you feel you're comfortable after graduation, but hopefully within 3 months. So develop your study plan. We talked about how do you need to think about how do you learn the best? What are your weak areas? What are some trouble spots? And you need to think about what are the key areas. So if you've got the blueprint, you could sit with the blueprint for either exam, and some of the things that you're really good at. I could tell you that what if I made a list of things that I felt and did a self-assessment would be my weak areas, would be the cranial nerves. Hate them, hate them. And I've got a little tip for it that hopefully will help you guys. What are some of the trouble spots? I know I hear students that get really confused about the asthma and COPD meds. So if you know that's a problem, you need to focus on that, and then figure out a way that you can remember it. And we'll talk about the scratch pad after a little bit, maybe some of the things that give you some ideas of what you'd want to put on that scratch pad when you sit down for the exam. So ANCC has actually practice exam questions. My slide's missing, that's okay. If you go to ANCC, their website, you can actually, even if you're taking the AANP, I challenge you to take the ANCC practice exam questions. Why not? They change every once in a while. They give you some rationale. They tell you how you did on them. It gives you an idea what they're going to look like. With the AANP, they've got that practice exam, the PSI. There is a fee that's charged. And like I said, there's a blueprint available to you, as well as the resources and reference for both exams. Okay, so make sure you take a look at that before you start your study plan. Oh, I do have the ACC it's here. So there's free sample questions. It's on nursingworld.org. You can find that. The blueprints there, as well as the resources. So, nothing ventured, nothing gained. And, you do hear some grumbling here and there that students do say that some of the questions that they have had when they test are identical to what they've seen in the past for some of these uh, study programs. So the more questions, the better. Practice questions. How many should you do? People always ask that. I would say at a minimum 2,000, okay? If not more. I mean, you can't make yourself sick, but when you're doing your study plan, you may say, okay, I am going to do on day one, I'm going to spend my 2 hours doing all the questions in my book for the pulmonary system, respiratory system. So you do that. What I would say is do your questions. You should be only taking about 1 minute per question. If it takes longer, mark it or move on. And after taking this, thinking about some of your test taking strategies, hopefully I want you to just take the exam. Don't be afraid of these questions. Just take it. Just do it like Nike, especially with the practice questions. If you get it wrong, you get it wrong. And I've always found that I learned so much from reviewing the questions that I got wrong. It doesn't mean you have to review every single one. I would review the ones you get wrong. And remember, it's like a marathon. Couch to 5K. What should we call it? Couch to advanced practice nerves. All right, so the practice questions that you get wrong, I want you to get a little notebook together dedicated just to your study stuff. And you want to make a list of the topics and disorders that you struggle with. I talked about it, the ones that you have troubles. You may want to make your own Quizlet, your own flashcards. For each of the disorders that you're having trouble with, I want you to ask yourself some questions, okay? I want you to write out the definition. What is hypertension? Okay, for example, what is impetigo? Um, talk about, the next bullet, put what is it? The scenario. What does it look like? We know with impetigo, if we go back to that, it's honey crusted exudate. Okay, what is a significant HPI? Multiple family members, school age children, something that's spreading on the face. Okay, think about your interventions for that disorder. How do you treat or correct this? Okay, what would you do next? Okay, so you may try some topicals. If that doesn't work, what might you use for your impetigo? Think about that. What would you prescribe? Meds, labs, diagnostics. Okay, and what are some of the anticipatory guidance that you'd be using? Okay, so for all the things that you have struggled with, I want you to make some of your own notes and your own study guides. Stress management. I think that the biggest thing is that will make you feel a little bit better is if you make a plan. And I say chunk it. I didn't curse, I said chunk. Chunk it. So make a plan, figure out how many systems that you want to get through before you test, and stick to it. Some people need longer than others, and that's fine. They say as you get older, you need a little bit more time. Um, I think a lot of us, when we're in graduate school, I call it laptop ass. You're behind the computer, you're doing your writing, you're reading, you're watching, you're creating, you're doing a lot of sedentary activities. So it's important to um, make sure that you add a little bit of exercise. Now, if you haven't been able to do that while you're in school, now that you're out of school, get out there, get some exercise, even 30 minutes a day, perfect. Um, your diet, this is important too. You're going to feel better if you're paying attention to what you're eating. I know, it's always a joke that nurses run on Dunkin', okay? But if you look at, all the sugar that's in the coffee, all the caffeine, you're on these uppers, just to get through and get done what you need to do. And this may be a good time to kind of, reevaluate that. And, try to set a goal of sleeping 7 hours a night. I struggle with this, and I have struggled with this my whole life. My kids kind of added to this to duress, but I've been really trying to do now, and it's taken me, a long time to finally make sleep a priority. But your sleep is very important too, especially if you're trying to retain a lot of information. All right, so sample questions, review questions, plan time for the activities before the exam, not the night before the exam. Yeah, okay. So one of the things I could tell you, on both exams, you are going to see some of the things that I call greatest hits. If you listen to any of my other videos, I talk about this. And what are the greatest hits? Dermatology, okay, asthma, COPD, coronary artery disease, including hypertension, asthma. I'm going to say that again, asthma. Okay, that's a big one on the exam. And Tanner stages, developmental stages, especially if you're taking the FNP, your adult Gero, you're going to need to know on the other extreme what are some of the stages that the advanced age may present with. Diabetes, always on there. HIV, murmurs, cranial nerves, hepatitis, and especially if you're doing the ANCC, your levels of research. Okay, it's always on there. This is from the beginning, and I want you to think about these different topics. These are the things that you're going to see in your clinical practice, probably daily. Okay, again, not rocket scientists that are writing this. This is just practical, where they get these exam questions from. Okay. And some of these are the ones, so you may be phenomenal with the COPD and asthma, but really struggle with your cranial nerves. Okay. Address it head on, and figure out a way that you can retain that information. Pictures to review. What comes up? The chest x-ray. Okay. EKG strips, the acting stages, cellulitis, your fundoscopic exams, otitis media versus serous otitis. What I could tell you is that you now have pictures on the exam, whereas when I took it more than 20 years ago, there weren't pictures, but guess what? They were describing all of these same things. And why is that? Because we see this all the time in clinical practice. Okay, remember this bad boy? I'm sure you all love him. Your fundoscopic exam, okay? Familiarize yourself with it. Sometimes students forget to do some of the simple things. They get really down into the weeds and don't familiarize themselves or review some of the very simple things that you're going to see. You need to know that the veins are bigger than the arteries. You need to know, what that optic cup and the optic disc should look like in the normal conditions and in abnormal conditions. Okay. Chest x-ray, common. And you guys know this. We know that the upper lobes is where you see your TB. We know that the lower lobes is where we see the pneumonia. Okay. If that cardiac border on the right, in the right lower lobe is obscured, we know that not the right lower lobe. We know that's a right middle lobe pneumonia, and we know, to go another step further, the right middle lobe pneumonia, we see that in our young people. Okay, that's one of the most common places for pneumonia to kind of settle. So once again, you guys got this. First degree block. Okay, if I showed you this EKG strip, you should be able to see that PR interval without calipers is definitely bigger than one box. Okay, they're not going to ask you, really obscure rhythms, your basics. An MI, we know if there's ST elevation, that this indicates an MI. I want you to think about the patients that are at risk for an MI. Okay, think about that. Somebody who's obese, the BMI is high, they have hypertension, diabetes, family history, all those risk factors. So that, keep in mind, it's not just looking at the pictures, knowing the whole scenario around it. There are some phrases to know, and I think that I always found this funny. If you talk to nurses from different areas, they may say something like, huh? So you think about targetoy, bullseye, your Lyme disease. I also recommend you do a suffix list, your LOLs, your beta blockers. Okay. Latin, you got to know your Latin when it comes to your tinea. Capitis is the head. Corporus is the body. Pedis is the feet. Carbuncle, I always think that's an old-fashioned term, but that's the same term for a boil or an abscess. Things like honey-crusted exudate, silver scales, your psoriasis, these type of things are all important little tidbits. And they may seem simple, but they are things that you want to definitely review. One of the things when you're answering your test questions, you want to think about priority. If you see words like first, initially, best, priority, safest, most, or least, they're asking you to rank or prioritize your patient's needs. And this may sound really simple, but you need to think about your ABCs, okay? And add an S, ABCs, just like it says, ABCS. Airway, breathing, circulation, safety, okay? You need to remember Maslow's nursing process, okay? It may sound silly, but some of the questions, when you look at them, they may be asking you to rank what is the biggest priority for the patient, especially if they're talking about a homeless patient or a patient, that is enduring some type of abuse. And when you're taking these exams, I always want you to think about, you want to put your patient before the equipment. A lot of us come from acute care settings, and we have all sorts of diagnostics and bells and whistles available to us. But remember, this exam is an entry level, and I want you to think about the environment which you are being tested for. If it's the emergency room, absolutely. You've got CAT scans, you've got cut downs, you've got ABGs at your leisure. You've got all sorts of things, stat labs. In primary care, that's not always the case. You may not jump to a CAT scan. And if you're waiting for a pre-approval, the reality of it is you're probably not going to get that CAT scan for a while. Definitely not that afternoon. So keep that in mind. Keep that in mind. All right, just to rewind back, and isn't this awful that we got to look at this again? But, you know, it may make a little bit of sense to you as you look at your questions that you need to look at the nursing process. Nurse practitioners, just because you are an advanced practice nurse doesn't mean that you aren't following the nursing process. I want you to think about this. You see your patient, you do an assessment, you just determine a diagnosis. Your plan is huge. Think about your soap notes, all those things that you're doing. Okay, you may not be actually doing them yourself at this point, but you are implementing this by prescribing. And then you're going to bring your patient back for follow-up. Okay, that's your evaluation. You're reevaluating all the time as advanced practice nurse. So keep that in mind and remember those steps. You're not going to evaluate before you assess. You're not going to implement before you diagnose. Okay, so keep that in mind as you're answering these questions. Maslow's hierarchy. Okay, if you aren't safe, not a whole lot is going to go on. So you just need to, familiarize yourself with Maslow and the ADPI, okay? You've already done this. You've already been tested on this on a standardized exam before, so you've got this. Okay. Levels of prevention. That's another one of the greatest hits. I would say this is beyond the greatest hits. This is a platinum hit. Okay. Know your levels of prevention. Okay. You prevent, you screen, you treat, you manage. Make sure you've got some examples. Look for examples of all three. So if you're asked a question about them, you really know what's what. All right, so fatigue is real when you're taking a big exam, okay? One of the things, if you feel like you're getting tired, you're getting sleepy, you're getting aggravated, you're getting anxious, take a bathroom break. You are allowed to take a bathroom break during the exams. It's fine. I think there's something to be said about standing up. Even if you don't go to the bathroom, go in there, wash your hands, walk around a little bit, um, kind of clear your mind, and then come back and get back on the saddle. There are studies that show if you chew gum going into the exam, that it actually is engaging your brain, and you'll